Good afternoon, everyone. My name is Jim Malatras. I am the State University of New York Chancellor. It's nice to be here on this tough occasion. We wanted to make an announcement, and then I will turn it over to some of my colleagues. I'm joined here with our great Oneonta President, Barbara Morris. We're joined by Mayor Gary Herzig. We're joined by the New York State Department of Health, represented by Gary Ginsberg. I give my regards to Senator Seward, who wanted to be here, but he has been actively involved in the situation and been briefed and been giving good advice and counsel, as well as Assemblyman Salka. I want to thank the local county health department for all they've been doing. And we've been working very closely with Fred Cole of UUP, the labor representatives of the faculty, who have been very helpful in moving this situation forward, as well as helping out on different campuses. So thanks to all of them, as well as we have two special guests, Jillian and Kevin, two juniors from the psychology department. We had a vigorous debate on the best pizza in the city. I am not going to wade into that debate because I feel like I'll only get myself in trouble. And then finally, we're joined here today by Hank Bennett, who is a senior advisor to the chief operating officer of the State University of New York System Administration, who I'll talk about what he'll be doing with us in a second. Today's a difficult day for SUNY Oneonta, but hopefully it serves as a wake-up call that COVID-19 is not done yet, that it could rear its ugly head, and it can rear its ugly head quickly. Last week, working with the President Morris, and as well as Mayor Herzig, we found that there were several large parties being held around the city area of our students. Unfortunately, some of those students had the virus, and we found through basic diagnostic testing right out of the gate that about 20 students tested positive for the virus. As a result, working with President Morris, Mayor Herzig, and others, we quickly deployed Syracuse Upstate Medical University personnel, that is our premier SUNY medical institution from upstate, to come to Oneonta to pool test or test every student at our college to get a broader sense of what's going on and whether the spread was more than 20. At the same time, we were still doing diagnostic testing of students because we found that there was 20 students stemming largely from the parties. As of now, because this is a changing and fluid situation, 71 students have tested positive for the virus. 34 students, this is not confirmed yet, have tested positive as a result of the pool testing that SUNY Upstate has done. Pool testing is a little different because we take multiple samples and we test them all at the same time. Out of the 29 pooled samples that we have taken, 18 of those 29 had the COVID virus in the results. We think there's about 34 of the individual students that had it. So as a result, about 105 students as of today have tested positive for COVID-19. That is about roughly 3% of our faculty, staff, and students who are on or using our campus right now. Therefore, and I mentioned it earlier on today, we will be suspending campus activities for 2 weeks, subject to New York State guidance. President Morris will talk about some of those details about what does that mean for students, but we will go virtual to all virtual online learning for 2 weeks. At the end of 2 weeks, we will assess the situation, working with the state health department and the county health department about what the next steps and courses of action are. We hope that this will be controlled so that students can enjoy this beautiful college campus and all the college experiences that they should be deserving. A couple of other things. In the meantime, while we take a pause on on-campus activities, we are going to continue to test every one of our students at SUNY Oneonta. That is going to be done with SUNY Upstate. This is going to be mandatory. This is not a negotiable test. So if students are using the campus, have had used the campus, we're going to test those students to make sure, first, that they are free from COVID. And if they do have the COVID virus, we want to make sure that we are stopping the spread. In addition, we are a proud member of the Oneonta community. This college has been here for more than 130 years, 131 years. We are good citizens of this community. We want to maintain that good citizenship. We work with this Department of Health. The governor, Governor Cuomo, with his leadership, is deploying a testing SWAT team from the state to come to the city of Oneonta, where they will establish 3 sites. The hotline will be up tomorrow where people can call, and the sites will be identified and released tomorrow. Testing will begin on Wednesday. It will be available to any resident that wants to be tested. It will be free, and it's a quick test. It's a 15-minute rapid response test. So you can get tested, and within 15 minutes you'll know whether you are COVID-free or if you have the virus. I highly recommend that every resident have access to this, get a test. We'll have that information, but I think that is a really important piece to help see what's going on in our community. We know we have a sister college with us, Hartwick, that we want to make sure that they have access to testing, and the community, that is an essential part of what we do here. The community has been so supportive of us. We thank Governor Cuomo and the State Health Department for deploying these much-needed tests to the community. Final piece, this is an all-hands-on-deck situation. As we see here at Oneonta today, 1 or 2 parties can grow where 1 or 2 cases become dozens and dozens of cases. And what I want to tell our students is we're going to be taking more actions for people who are not complying with the rules. Not because we want to be Debbie Downers, not that we don't want our students to enjoy themselves. I am a graduate of SUNY. I went to 2 SUNY institutions. I understand how the social element is just as important, but we are not in normal times. A small minority of people who aren't following the rules can ruin it for everyone else. So before people start thinking about themselves, not wearing masks, mass gatherings and parties, think about that senior on campus who may be sent home and not being able to enjoy their last year of college because of your activities. For those who are violating the rules, I think President Morris has acted swiftly and judiciously and expeditiously on suspending those students who have violated the rules, suspending those organizations on campuses that have not been doing the right thing, and she will continue to do so, as well as our other campuses. Not because we don't want people to have fun, because you see the result of people who don't follow the rules. We have 105 cases as of now. That's likely more on this campus. We think we can contain the spread, but this should be a wake-up call for everyone that this is real and still an immediate threat to our health and public safety of our entire community. To that end, we want to continue to support SUNY Oneonta, President Morris and her team, Mayor Herzig and his team, the county health department, the New York State Department of Health. They have been phenomenal. The State Department of Health is going to help support what we're doing here. They have sent 8 case investigators as well as 70 contact tracers to help monitor the situation, manage the situation, so we can keep that under control. I want the community to know that that is significant support, that we can control the beast, which is COVID-19. And finally, Hank Bennett, who is our special advisor from the system administration, who works with me at System, will be staying here to help manage the crisis with President Morris and her team. Hank has worked in the federal government. He has worked for the state government. He excels in these crisis situations. So we are also going to lend his expertise to manage the next 2 weeks to make sure that we can control the situation, that we can return our students back to classrooms. We're going to do testing, but I want the community to know we are a proud member of this community. We want to instill confidence in this community. We're going to have testing. We hope this is a wake-up call for everyone, and I look forward to coming back and seeing our students once again participating at this beautiful campus. So with that, I'll turn it over to President Morris.
Thank you, Chancellor Malatras. I'd also like to acknowledge that Bob Wood, our elected county supervisor, is with us today as well. This is indeed a very sad day for SUNY Oneonta. But as our mission statement begins, we nurture a community, and our ethic of care will get us through this time. I want to say a lot of thank yous. First, to the students who have been social distancing, not gathering in large numbers, wearing their masks, and doing hand hygiene. To thank them, because this is very difficult for all those students that have been abiding by the rules. We know that it's just a few that haven't, and now we know the consequences of that. So what does it mean to pause? It means that in-class instruction, hybrid instruction, any instruction on our campus will be suspended for 2 weeks. That's only 3% of our classes. We have 97% already online. So I want to thank the faculty, first and foremost, for their academic continuity plans. They are prepared for this. They will ensure that the students, not only the 97% that are already online, but those 3% that were in person, will continue those classes and continue to get the quality education they deserve. With regards to events, I know that our residential staff and our student life staff have worked hard over the past few months to have activities that were properly social distanced on campus. And unfortunately, those activities will be paused for the next 2 weeks. So there won't be any club activities. There won't be any activities with regards to athletics or gatherings outside of the dormitories. And so we will still have virtual activities, which our team has done. So I want to, again, thank the residential staff as well as the student development staff for, again, their continuity plans to keep our students engaged over the coming tough 2 weeks. Additionally, the bus service, students will not be allowed to leave the campus. We will be working with our health department to quarantine in place. So our students will be remaining on campus, but they will be quarantined. They will be very limited with regards to where they can go. It'll essentially be limited to their dormitories. We'll be working with dining service on how to make sure that dining service is delivered properly to those dormitory rooms. With regards to operations, is that our facilities will return mostly back to where we were in terms of our telecommuting plans, where we'll reduce the density of staff on campus and have those essential on campus as needed. We, again, are working with the health department with regards to what does it mean to quarantine in place for our residential students. With regards to the sanctions, we have taken swift action. We've had the 5 students that were the host of the parties. They have been placed on interim suspension. And we've had 3 organizations that have now been suspended for the academic year. And so we do take this seriously. This is a very tough time for SUNY Oneonta, but with our ethic of care, with our determination and our grit, we can get through the next 2 weeks. And as the governor says, even though we were the uphill climb, we can take this down and we can show the rest of our community, the rest of New York, that we can tame this beast, that we can contain it, and that then we can move on to our normal operations. So thank you.
First, I want to say a big thank you to Chancellor Malatras. All through this week, he has shown a keen involvement, a keen interest in the well-being of the people of the city of Oneonta. He's been on the phone with me every single day. He's been hands-on, detail-oriented, and gives me great confidence that we have all of the resources of the SUNY system focused on the city of Oneonta, and it's greatly appreciated. I also want to thank Department of Health Commissioner Zucker for sending resources our way, tracers, investigators here to the city of Oneonta, to make sure that we are doing this in a scientific way to prevent any further spread of this disease. I want to thank the Governor Cuomo, who announced today that he is providing pop-up testing sites for the people of the city of Oneonta. This will be rapid testing, be set up at, I think, 3 different locations here in the city. It'll be available to all local residents who are concerned or may feel they've been exposed so that they can be reassured, or if we hope not, they're positive, they know to quarantine. So what we are seeing is that we have the resources of the state of New York keenly focused on Oneonta, and it's very reassuring and gives us confidence that this is a challenge that we will undoubtedly get through. I also want to thank President Morris. Her swift action, she's adopted a no-tolerance policy. Again, it's a very small number of students, a tiny percentage that don't get the message. And, you know, that happens whether you're an adult, you know, or at any age. There are always a small percentage of people who just don't get it. And I think that President Morris's actions are the right ones. I know they're difficult actions to take, but they're greatly appreciated because all of the students, like the 2 students here that we're chatting with, deserve to be able to continue their education. And if there are a few that are making it difficult or even jeopardizing the health of others, having them removed is the right thing to do. So thank you, President Morris, for that. Clearly, this is not where we want it to be. But together, I have no doubt that we will get through this. The Chancellor called this a wake-up call. You know, I echo those sentiments. This is not a time for alarm. We have the resources. We have a strategy. There is a comprehensive plan of attack. We will get through this. But it is clearly a wake-up call, and not just for young people. It's a wake-up call for people of all ages. We all read the newspaper, watch television, hear about these parties that take place, and it spreads like wildfire, and everybody has a sense of, well, that won't happen here, or that only happens in rare occasions. Well, we've learned something today, that it happens everywhere. It happens here, it can happen everywhere, and that this disease is extremely contagious. So we will learn from this. We will go forward. I am confident. I appreciate all the resources that are being sent our way. And the city of Oneonta has been through challenges before with all the help we're being provided, working in partnership with President Morris and SUNY Oneonta. We will get through this together. Thank you.
Sorry, I just needed to say a lot of thank yous again to our facilities staff that have been working overtime, not only to prepare for students to return to work and to care for our employees with modifications of our facilities, but in the course of this week, you can imagine all the amount of work that they've had to do, as well as our healthcare professionals and our resident staff to, again, keep our community healthy and safe, and just deal with 20-hour weekdays. And again, thanks to OPD and UPD for their cooperation as well. So again, there's a lot of team effort and a lot of good effort and a lot of community. And again, I thank you, Mayor, for everything that you've been doing as well.
Any questions for our speakers? Beginning with the Chancellor.
Mr. Malatras, we're the worst off of any of the campuses, I understand, you've determined. What did we do wrong? I mean, what did we miss here? Have you determined that because you really...
We're still investigating how this situation came to be. So I don't want to cast aspersion or get ahead of the investigation. What it seems like in the preliminary matter was several parties early on became events where the spread happened. Several of the students who attended those parties had the virus. There wasn't social distancing nor mask usage. And that just goes to show you how quickly a party with 50 people can become 105 cases in a matter of days. And I think that's what you're seeing. I think there's been other situations on other campuses, public and private, where there have been parties. But this is a situation where it was a confluence of circumstances. Positive cases, the person attends, they're not symptomatic, right? No masks, no social gatherings. Then they attend, they infect somebody else. That student goes to class, that student goes to the restaurant, that student goes to the grocery store, and then you see how quickly this spreads. But that's a preliminary finding. We're going to work with the local Department of Health. We're going to work with the State Department of Health to determine that, because I think that will help potentially tailor what response we have to do as an Oneonta community going forward. There may be some other additional things that we have to set, but that is what it looks like currently today.
If the problems are off campus, how do you isolate those students? How do you protect the rest of the community from people that might be either quarantining or infected that are not on campus?
This is a collective responsibility. And I believe that not just because I'm the chancellor of the State University system. I think there's a symbiotic relationship between the community and the college. In many ways, the college is a community, is part of the community. Like any other situation, everyone has to comply. There's people who go into the grocery store still to this day who don't wear a mask. And that's not right, right? We want to protect one another. There are a minority of our students, and I think the mayor was right, and I think the president was right. This is a minority of students. This isn't everyone. I talked to 2 great students today. They want to stay here. Most people are complying. But it goes to show you how a small minority can impact the larger community. That's the person walking into the grocery store not wearing a mask. That's a person who's not complying with other social distancing and other orders, or it's a student who's going to a party. I think what this does show is that we have to band together as a community, because we have students that live off campus, but we also have members of the community that work on our campus. They provide food services and other services, and we want to make sure we're protected with our community broadly as well. So to me, this is not an us versus them. I reject that. Our SUNY colleges and universities have been in upstate particularly for more than 100 years in many cases. Before the SUNY system was even the SUNY system. We've enjoyed a great relationship. We have a great relationship with the mayor and the community. They provide a lot of opportunities for our students, but we have to band together now as a community and say we have to do better.
What is needed to resume in-person learning, and your confidence in that will happen?
We're going to see over the next 2 weeks. I think we have to monitor first how many more additional cases do we have. I think 105 is not the final number. So it could be higher. We're going to want to work with the county health department and the state health department. Do we have the protocols in place to come back safely? Because ultimately the safety of our students, our faculty, and our staff is our paramount concern. That's what the president worries about. President Morris is worried about that. That is what the mayor is worried about for the broader community. I think the broad-scale testing of Oneonta community, the free rapid testing that the governor has put forward today, will help see if there's a broader community spread, right? Because we're assuming that this came from the party or several parties of our students, but it could be somewhere else too. That's why I don't want to say this definitively what the case is, but we'll get an understanding of whether this is more wide scale. And in 2 weeks, we'll assess. Do we have the infection rate down? Do we have the COVID-19 situation under control where we can feel safe that people can come back? And then we'll see. I'm also, and we've been talking to President Morris about this, we still want to maximize educational opportunities for our students. We want to make sure that the online transition works well. We want to make sure that they have health and other mental health services, because this can be an isolating event for folks. So all of those things are going to work in concert with one another while we assess the situation over the next 2 weeks. But these are a critical 2 weeks. If we see lack of compliance, if we see cases still going up, we will make those tough decisions as we see them. But this is with the public health in mind.
What is the contact tracing?
That is the current situation. What we're finding in preliminary contacts is this was stemming from several large gatherings or parties of students, but ultimately the state has provided another 70 contact traces, which I think will help our situation immensely. We'll get more detailed information. I would defer to the state health department or the county health department as those situations emerge.
Any other questions?
What if parents don't feel comfortable with their kids on campus?
So if we've already had students that have, been asked to quarantine or isolate, and the parents have come and picked them up, so they have the opportunity to pick their children up at any time. We just would, make a protocol with regards to making sure that we have the proper social distancing if we have a number of parents coming to pick up their students. What we don't want, especially if it's a student that is tested positive, we don't want, someone to pick them up and then become infected, or that we certainly do not want them to ride in public transit. So we're going to be monitoring that as we go.
The students who aren't tested positive, the parents at home hearing this, they don't want their kids on campus anymore. Can they just bring them home and have, virtual learning?
They can bring them home for the next 2 weeks, and then we'll see as we go into returning to campus with online. We have, again, 97% of our courses are already online, so the bulk of our students, we have about 1,300 students that take some kind of face-to-face course throughout the semester.
All right, next question.
Was it Mark? So I have a question. So you talked about a response initiative to the outbreak. Why wasn't there mandatory testing before all students came back to campus like so many colleges across the country?
Well, we used the best science at the time, and what was being as articulated through the SUNY system is that, as you know, testing, depending on where you're at and the type of test, there's different types of reliability, and that a test is a one-shot indication of whether you're negative. At the time, the best case was to isolate prior to coming. So when you've isolated for 7 days, or if you came from an out-of-state for 14 days or internationally, that was seen as the best in terms of ensuring that you wouldn't have the spread. And so in addition to that was importantly our surveillance. And there's surveillance through our innovative wastewater mechanism to be able to actually see that very early on, even prior to any symptoms, as well as the pool surveillance testing that we're undergoing now. Again, if all things had gone the way we hoped and anticipated, we would have begun the surveillance, we would have gotten the wastewater, we would have begun the pool testing, already. And again, I'm very thankful to Upstate Medical and to SUNY for bringing 3,000 cases in short order so that we can test and do the surveillance and continue forward. Thank you.